Okay, so next one is a man exposed to cold developed. A man exposed to the cold developed skin color changes. What is the diagnosis? Reynolds phenomena. It is vasodilation of the skin, vasodilation of the vessels because of cold exposure. That is known as Reynolds phenomena. Most common cause of thyroid carcinoma is papillary carcinoma. There are three types: papillary, follicular, and anaplastic. Papillary carcinoma is the most common type of thyroid cancer. 10-year-old male patient having receding hematuria and a receding sore throat for 2 weeks. What is diagnosis? Post streptococcal glomerulonephritis is the diagnosis in this condition. Next one is in diabetic ketoacidosis. First line treatment is IV fluids is treatment. First line treatment. Another one is rehydrate the patient, give insulin, and also monitor the electrolyte balance in the patient and manage according to death. A 10-year-old patient, hematuria, preceding sore throat, post-streptococcal glomerulonephritis is the diagnosis. Next one is ketoacidosis, IV fluid is the treatment. A patient with nephrotic syndrome, present with certain breathlessness and chest pain, pulmonary embolism is the diagnosis. Next one is a child with red urine, edema, hypertension, and impetigo. What is diagnosis? It is post-streptococcal glomerulonephritis is the diagnosis for this condition. First line antihypertensive drug in diabetic patient with proteinuria is losartan is given as an antihypertensive drug in diabetic patients. Next one is 60-year-old male having chronic smoking history, chronic cough history, hoarseness is there, lung cancer is there with recurrent laryngeal nerve involvement because there is hoarseness, and chronic cough, that is lung cancer with recurrent laryngeal nerve involvement is there. Another one is a main present with pain, swelling, greater toe, joint fluid shows needle-shaped negative bifurcated crystals. What is the diagnosis? The diagnosis is gout because needle bifurcated crystals are indicative of development of the gout in this patient. Okay. In iron deficiency anemia, in iron deficiency anemia, which of the following is characteristic, which is decreased, that is serum ferritin level is used in iron deficiency anemia. Next one is a 65-year-old male patient present with a hypertension, that is pain irradiating the back, BP is unequal. What is diagnosis? Aortic dissection is a diagnosis for this condition. Next one is a patient present with periorbital swelling, urine lysis shows proteinuria. What is the diagnosis? That is minimal change disease is diagnosis for this condition. A patient with chronic GERD has dysphagia, and next step for diagnosis is upper GI endoscopy is performed in this patient. Which of the following is first line treatment for status epilepticus? First line treatment for status epilepticus is lorazepam. First line treatment for status epilepticus. Another one is the which condition is characterized by fever, sore throat, atypical lymphocytosis. The diagnosis is infectious mononucleosis. Heterophile nuclei with infectious mononucleosis is diagnosis choice for this condition. Another one is a main patient present with painless hematuria, bleeding in the urine. History of most likely diagnosis is bladder carcinoma because this patient has bleeding in the urine, and that is diagnosis of a bladder carcinoma.